Watching the Stoney Love show this morning. And every day is a new beginning, so let us now begin. Our guest today will be entrepreneur, nonprofit leader, Alzheimer's advocate, and executive director, Miss Sylvia Ray. And the AJC news today, I always try to get a little news for you guys. Suspects charged after a man found shot to death in Paulding County home, and two Metro Atlanta daycares under investigation for alleged child abuse. Now, Georgia daycare worker gets life in prison for molesting children. So y'all gotta watch your children. I mean, these daycares, they seem to be reputable, but then it seems like the people that they're hiring aren't. One dead in a shooting in West Midtown apartment complex, and a Douglasville County jailer, that would be the officer that works there, is charged with having sexual contact with the inmate. Well, in celebrity news, Ray J gets slams from his fans after getting a Brandy tattoo on his leg. He says, "It's my leg, and well, it's my sister." It's kind of weird. I don't know if I want a tattoo of my brother or my sister on me. I don't know about that one. I love y'all, but I don't know. Uh, a production company is suing Kanye West for $7 million, stating that they're making him pay because they were made to wait too long for the start of production for different shows that he was sponsoring. Everybody knows that mental health is one of the number one factors in America. A lot of us has been affected in so many ways. And the National Suicide Prevention Lifeline is replacing its 10-digit phone number as of tomorrow with 988 for Mental Health Lifeline. So that's going to be their 911. So whenever there's an issue with a family member or someone that you are close to, or you see something, someone is in the midst or thinking of suicide or having a mental health breakdown, 988 is the lifeline number. So you want to write that down for mental health. 988, and that number will be working as soon as tomorrow. Coming up, Alzheimer's disease is a progressive neurologic disorder that causes your brain to shrink and your brain cells to die. When we come back right after this message, we're going to talk to Miss Sylvia Ray. She's an Alzheimer's advocate, and we're going to talk more about Alzheimer's and the disease today. We'll be right back after these messages. it's very imperative. And I mean, I mean, for one, trying to learn about it.
Mm-hmm.
Because my grandmother, I believe it was Alzheimer's, but I was young.
Right.
But
Right.
I just
Because we didn't talk about it. What we related it to is that it was they were just and they were getting senile.
That's right.
That's what we labeled it as.
That's right.
Because we didn't know.
Right. So true.
And I only learned about it because my mom got sick.
Oh.
And so we thought that it was, because I started doing research and Alzheimer's came up. So I just related that that's what it was. But that's not what she actually has. She has vascular dementia. So
there's a difference. So we're going to talk about that too.
Yes,
If that's okay.
Yeah.
Because people don't even know that because, wow.
Yeah.
So
people think that Alzheimer's and dementia is two different diseases, but they're not. They're actually the same. Dementia is the broader umbrella, and Alzheimer's is just the most common. So that's all people know is Alzheimer's, but they don't learn about the other types. And so that's how I really started getting into it.
The researcher.
Yeah, because I didn't know, I just assumed she had Alzheimer's, but that's not what it was until we took her back to no.
Nonprofit um, leader, Alzheimer's advocate, executive director, Miss Sylvia Ray. How are you today, Miss Ray?
I'm great.
And
It's
is it okay
early.
to call you Sylvia?
Yes, it's fine.
Okay, thank you. Yes, it is early, and I want to say thank you so much. This is our take two right here, so I really want to say thank you for coming back again this week.
No problem.
It's been your patience.
It's my pleasure.
Thank you. Alzheimer's disease is a progressive neurologic disorder, and it causes the brain to shrink and the brain cells to die. What caused you to become an Alzheimer's advocate?
Well, back in 2002, my mom suffered from a ruptured aneurysm. And after the second surgery that she had in 2007, it left her brain memory, because it was the memory part of her brain. And so they told us that she had dementia. So I said, okay. So we started looking up, what is dementia? And the first thing I found was Alzheimer's. So I got very involved in Alzheimer's, and I wanted to learn more about it. So I became part of the Georgia Association, Alzheimer's Georgia Association, and I started walking and raising funds for Alzheimer's disease. So that's how I got very involved.
So you do like those marathons, well, not marathons, but those
The walk,
maybe 3K or
the
whatever.
walk to end Alzheimer's. That's what I got involved
That's
in.
beautiful.
Yes, yes.
Okay.
So I started out in Peachtree City and started walking with them because my husband and I, we had our own business, so we wanted to give back to the community. So we started walking with the Peachtree City Walk, and I got just so amazed with how the walk was put together and everything. And so I live in Henry County, so to go to Henry County to Peachtree City was very far, and trying to get people to get involved was very hard. So I convinced the Alzheimer's Association to let us start a walk in Henry County. So in 2017, we started our first walk. in Henry County. And that walk began to grow. And then I found an adult daycare center because I had to take my mom to adult daycare center. So I had found an adult daycare center that's what they specialized in is all of their clients were clients who suffer from Alzheimer's disease. So I am currently the director there at that adult daycare center. God
Really?
opened up the door for me, and now I am the executive director of the Alzheimer's Services Center located in Morrow.
That is amazing. So your mother is she still with us?
Yes, yes,
Okay,
she's
thank
still
you, Lord.
with us. Actually, she was here with me the other day when I came.
Oh, no, I missed the pleasure.
Yes, yes.
Oh my
So
God.
that's how I got started, and that's how I got all involved. And so I consider myself the Alzheimer's expert.
So how would I detect? My father is 83. So how would you what are some of the symptoms that may show on someone who is going into that dementia stage?
The first things is they'll get forgetfulness.
Simple things like is where they left the keys, possibly.
Right,
Okay.
right. And so that's the start. Then they'll begin to hide things from themselves.
Oh.
So like they may put. So I always like to use this analogy because we had someone. They would take their purse and put it under the sink, you know, because they're always fearful that somebody is trying to take something away from them.
Oh, my mother was
So,
like that
yes,
before she
yes,
left us.
yes. So
I just thought she was tripping about the people in the household.
and then they'll start having problems with their daily activities, you know, daily hygiene, doing simple things like cooking, things they used to do every day, they're no longer able to do. So those are the simple signs. And once you start to see those signs, then it's time to get them to a doctor so that they can be tested.
Now, is this something? I don't know a lot about Alzheimer's. I've read some information periodically and just skimming through. I know that they were saying that maybe the cause of Alzheimer's is a bacteria that could possibly be found in the mouth. This was a recent. Have you heard of that study?
I haven't heard of that one. That's something new that
Okay.
they must have just found out. Because I actually, as I was sitting here waiting on you, I'm always looking to try to see if there's any new things out there. And so I know that they were saying something about the brain, the brain cells, and the brain cells starts to change and stuff like that. And now they have studies where they can do a PET scan or a spinal, get sample of the
Like a
spinal
spinal
fluid.
tap.
Get samples of those
Wow.
fluids so that they can tell if a person, so they can be properly diagnosed. Because that's the key,
Right.
being properly diagnosed.
Because as far as what you're saying, there is several diagnoses of dementia,
Correct.
but they could not have Alzheimer's, or is dementia Alzheimer's?
Well, it's the other way around. Dementia is the broader term.
Okay.
Alzheimer's is a form of dementia. Okay, it's the most common. By about 60 to 80% of people who are diagnosed, they're diagnosed with Alzheimer's. And then the second type and the most common is vascular dementia. So as I was talking to you this morning, I was mentioning to say that, my mother wasn't properly diagnosed. They just said dementia. And then I found out that it wasn't Alzheimer's that she had. It was vascular dementia that she has.
So is it true that eating certain foods and exercising will give you the ability to not have the what is the word I'm looking for? The neurologic, the decline
The decline.
of cells in
Right.
your brain.
And that's correct. That's
Okay,
correct.
so
That's correct.
exercise.
Exercise, eating
Puzzle,
healthy,
and
eating healthy, and
I hear
all of
people
that.
saying puzzles, doing lots of.
Yes, keeping
Okay.
the brain stimulated.
Okay. So, okay, I can see where that could be. And so, like at the daycare where your mom goes, can they reverse by doing these activities, or they can, or is it no? Once you get it, is it? It's,
Right. Once you get, there's no cure and there's no reverse. Okay. But
Okay.
what it can do is slow down the progression
Gotcha.
and keep them in their daily living longer.
Okay, so
Okay.
by doing
So,
these exercises, even though, say, for if I become with Alzheimer's, and you put me in a program where I'm doing daily activities like puzzle work, matching things, small assignments during the day that's conducive to what I can do,
correct.
that will slow down the
Correct.
process of the disease spreading and making me not just dependent on.
Right. So I'll even use this for an example. So you know, back in 2020, we was all hit with this pandemic.
Yes. Yes.
And so the center, the daycare that I managed, you know, we had, before the pandemic, we must have had about 30 clients that came, you know, an average of 25 to 30 clients that came every day. And so at the center, you know, they learn the social skills, you know, being around other people. You know, we do the puzzles and the games and the dancing. Alzheimer's patients, they love to dance. They love music. So we do the things that we know that they love. Well, once the pandemic hit, everything shut down. So now you have these people who were once, you know, being around other people every day, they're secluded because they're the most vulnerable.
Right.
So it took us, I mean, other daycare centers opened back up before we did, but it took us 2 years
Oh.
to you know, feel safe, to want to
Right.
bring them
Back
back
together.
into the building and you know, to socialize, because of the disease and the memory, you know, they're not going to remember to keep their mask on. They're not going to remember to stay 6 feet apart. So, you know, those are things that we have to do, and we had to make sure that we kept them safe, and their loved ones wanted to make sure that they stayed safe. So now that we reopen, we have lost about half of our clients. They didn't die from COVID, but they passed away because of the decline. Because now they're home all day, not doing anything, not stimulating their brain and stuff like that. So a lot of them have passed away, and then we had some that had declined, that had to be put into nursing homes or assisted living. So
Wow, that's.
yeah,
So it's best to keep your loved ones busy, keep
Yes.
them active, walking, and even the same with our children. I was reading stuff about things about mental health,
right.
and men, the suicide prevention line is launching their 911 number tomorrow,
Oh wow.
and it's going to be 988.
Okay.
So make sure you spread that
Yes,
around.
will
So,
do.
yeah,
Will
so they're
do.
getting ready. It's no longer the 10-digit number. If someone needs help, they call
Okay.
988. I think that's
Okay.
pretty awesome.
That is awesome.
I'm very,
That is
very
awesome.
big on mental health. I have a lot of empathy for people with Alzheimer's, people who suffer from mental health issues. We never know what's going on with someone.
That's right.
So we never can judge or turn the other cheek.
That's right.
When we see someone that is mental health or in a situation where they may need help, get even if you have to stand afar and call for medical attention, get those people help.
Correct.
Don't just walk by, because that could be your mom or that could be your cousin or
That's right.
one of your relatives, and you would want someone, because people have a breakdown at any moment. Sometimes life is just so unbearable, and some people just don't know about prayer, or they don't know how to come and say, "Excuse me, ma'am, can I just talk for a second, or
Right.
can you just sit here with me for a moment?" some people don't know how to do that. And so sometimes all it takes for one of us to just listen. And so when we come back, we're going to talk about your nonprofit organization,
Okay.
and how you give back to the community. And after these messages, we'll be right back with Sylvia Ray.
What is it, Julia? Why are you so excited, honey? Oh, oh hey, do you want to use your talker? Oh, with Julia's autism, using a talker can help her find the words she wants to say.
My dog.
Oh, you want to do something with Rose, Julia?
Play ball.
Oh, do you want to play catch with Rose? Oh, I think Rose is excited to play catch too. Oh, Julia, you show us so many different ways to talk together. Oh, and play. Good catch, Rose. Okay, give Julia the ball. There you go. Okay, throw the ball, Julia. Oh.
For Julia's family, early screening for autism made a lifetime of difference. Find out more at screenforautism.org.
Okay, Julia, there you go. Whoa, another good.
Welcome back to the Stoney Love Show, and I have with me entrepreneur Sylvia Ray this morning. I want to say thank you so much.
You're welcome.
Sometimes I get stuck because Lord have mercy, it's Friday,
Yes.
and an old lady done made it the whole week, y'all. How y'all doing out there? I mean, literally, I hope that y'all are waking up this morning smiling, got your nice cup of coffee, your orange juice, and you're getting your vitamins in, you're stretching, thanking the Lord for a new day. I'm not a minister, but I'm just saying, you know,
Yes.
I just want to keep putting good things into you in case sometimes you forget. Sometimes we forget
That's right.
that we got to continue to nurture ourselves and put good things into ourselves.
Yes.
I always just try to feed my spirit with good things, because we start listening to negativity and be around people and the naysayers. Soon, we start becoming haters and thinking we can't do nothing. My mama always say you are like the flock that you know that
That's
you hang
right.
around.
That's right.
So I try to always surround myself with go-getters and people who are climbing the mountain just as I am. Now, Miss Ray, you have a nonprofit organization.
Yes.
Now, what does your nonprofit do? I like nonprofit organizations because
Okay.
y'all give back to the community.
Yes, we do. Yes, we do.
Yes.
So I am the executive director of a nonprofit organization,
Oh,
the
okay.
Alzheimer's Services Center.
Oh.
We are a 501c3 nonprofit, and what we do is we're an adult daycare center for anyone with diagnosed with any type of dementia.
Okay.
We also have overnight respite for these clients. And then we also
Now,
do,
for anybody who doesn't know what that is that like when they are transitioning?
well, no, our overnight respite is actually for the caregivers. Anytime they want to take a break
Oh,
and they need a break, because caregiving is very, very stressful.
it is.
So they can bring them to our center. We do weekend respite. So they can bring them to the center on the weekend and just, go away for the weekend.
So say for instance, if the client doesn't have insurance, do you accept cash payments or?
Yes, a lot of our clients, so we have clients who are on Medicare.
Okay. And most
so
at an
we have-
elderly age will be on Medicare.
Yeah, if you qualify. So you
Oh.
have to qualify
Okay.
for Medicare, because Medicare has a program where they will pay for adult daycare center, or they'll pay a portion
Gotcha.
of the services.
Okay.
And then our other clients are private pay clients. And then we also have, there's different grants that you can get to assist you with your payments as well. Because your regular insurance does not pay for an adult daycare center.
Oh, I see.
Or Medicare does not pay for it either. So it's Medicaid or either private pay, or you get some kind of other
Assistance.
assistance. There's other organizations. So we partner with Clayton County Senior Services, because we're in Clayton County.
Okay.
So we partner with Clayton County Senior Services, and they have a grant that they will, that they set aside for us for respite. So if you live in Clayton County and you have a need that you need to put your loved one in a daycare center or something, you can qualify to get a grant, and Clayton County will assist you in those payments.
Wow, that's beautiful.
Yes. And then the last part of the services that we offer is caregiver support. So caregivers need support. Because like I said,
Yes.
being a caregiver is very, very stressful. And I know that because I'm a caregiver myself. So it's very important to love on the caregivers too. Not just the person who suffers from the disease, but also the person who cares for them. So we offer caregiver support group. We have a gym at our facility that the caregiver can come and work out anytime, as long as, we're
Right.
doing our hours of operation. And we also have a room dedicated just for them, that they can come and has a computer, massage chair, a TV, where they can just get a break if that's what they choose to do.
So although even if I don't have a patient there and I'm a caregiver, I can still come into the center.
Yes,
Oh, that's
Yes.
awesome.
yes, for a small fee, we'll let you come.
So you gotta have like a membership or something.
Right,
Okay, caregiver membership.
Yes.
That's really nice.
yes.
Wow.
So that's what we do.
Wow, that is so. It doesn't matter that I may live in Cobb County.
No,
Okay.
no.
So will you be expanding your services throughout the state of Georgia?
That's the plan. That's the plan. Right now, we service Clayton, Henry. We do have some clients that come from Fulton. We do have some clients that come from there, and Fayette. Those are the main. But we would like to
Expand.
expand. Yes.
Wow, that is so amazing. Tell everybody where they can locate you. And is there a number? Do you remember maybe for Alzheimer's people that have Alzheimer's? Is there a number?
Yes. So we're located at 7251 Mount Zion Circle in Morrow.
Okay.
And our phone number is 770-603-4090. You can also, we have a website, which is www.ascga.org.
ASC.
ASC, Alzheimer's Services Center. So it's ascga.org.
Okay.
And you can also follow us on social media. Our Instagram and our Facebook is at ASC Morrow.
Beautiful, beautiful.
Yes.
And so, do you have a personal? But everybody can come through that social media information to get to you.
Yes, I do have a personal social media as
Okay,
well. You can
okay.
follow me at Sylvia D. Ray.
Okay.
Ray is WRAY.
W.
RAY. So
That's what I
it's
have.
Sylvia D. WRAY.
Right.
You can follow me on Instagram and Facebook.
Well, there you have it, folks. We've had a very nice sitting down with Miss Sylvia Ray. And if you know anyone that may need help with dementia or anything of that nature, reach out to her. And if she cannot help you, she, I'm sure, has other resources that she can refer you to. Is that correct?
Yes, we do. We do.
Right.
I'm very connected with the the Georgia chapter.
Okay.
Walk to End Alzheimer's Georgia Association, Alzheimer's Association. So they have a 1-800 number that you can call anytime if anyone in your family and you just need to talk to someone. So they have a hotline that you can call. And I just wanted to mention one other thing. Remember we was talking about nonprofits giving back?
Yes.
So during the pandemic, we had the pleasure of partnering with the USDA. And
That's
during during the pandemic, we fed over like 90,000 families throughout the pandemic.
90,000?
With boxes, food boxes.
Wow. So it was like a Meals on Wheels type
Well,
of thing?
it was so I don't know if you remember the USDA was giving out food boxes and it was like you would get meat and fresh vegetables
Yes.
and stuff like that. So we were able to get in the last 2 rounds that they had, and so we fed people within the metro Atlanta area. We had people coming and picking up food boxes, churches coming. We would give it to the larger people. So we had people coming, and we also had like churches would come and pick up the boxes from us, because
Oh, that's beautiful.
every Friday we had at least at the minimum 3 truckloads.
Now, do you
coming
guys
to
have
our
any
facility.
upcoming giving back to the community?
Yes,
upcoming?
we're actually gonna partner with a Gen Care,
Oh,
which
Gen
is low
Care,
care. We're gonna partner
yes.
with Gen Care, and we're gonna be giving out. We were talking about giving out food and the pins, like diapers and stuff.
Yes.
For the seniors. Yeah, because we got a large donation. Someone donated a large donation of
That
the
is
pins. So
beautiful.
we're gonna partner with Gen Care, and we're gonna have a big community event. We hadn't picked a date yet, so it's in the making. So you just follow us on social media and you'll find out.
Yes, you guys make sure y'all keep up with Miss Ray, because she's giving back to the community, and I know that a lot of my listeners have elderly parents or aunts that they're caregiving for, and they need to know the resources that's available to them.
Yes,
So
yes, yes.
make sure you guys reach out.
And
if
we'll
you
also
have-
be giving away some tablets and cell phones for seniors.
Really?
So, yes.
Oh, now that would keep them active.
Yes. Yes.
The little games and things that they could play almost.
Yeah.
Oh, that is so
So
amazing.
that'll be the third part that we're doing as well.
Oh, and that is upcoming this year?
Yes, it's upcoming this year.
Oh, that is amazing. So you guys hear that? So make sure you guys follow Miss Ray and keep up with her. Can you please give them your website one more time?
It's-
Because somebody's going to call and ask me for it, and I'll be calling you, and
It's www.ascga.org.
Oh, there you have it, folks. It's been a very great pleasure sitting with Sylvia Ray today. I hope that you are going to have a fabulous weekend. Keep on going and do the best you can. That's what I tell you every time. Because no matter what life brings you, no matter how hard it gets, you can only do so much. But always know that if you do the best you can, you're doing an amazing job. So if you want to see me Saturday, I'll be at Stonecrest Mall with Bernice King. Yes, she's launching her new children's book. So if you guys want to come out and see what her new book is all about, I'm sure she will love to have you. And I'll be at the Stellar Awards also this Saturday night. So I don't know if you can catch me there, but I'll make sure I include some great clippings of what's going on behind the scenes right here on Clark TV Network. And until then, I'll see you on Monday morning right here on Clark TV Network and 108 Praise. Have a great weekend.